My name is Sohan Sahota. I am the co-founder and managing director of BAC-IN. BAC-IN is a drug and alcohol recovery support service based in Nottingham. It's peer-led, grassroots, and we specialise in supporting people from the black and ethnic minority communities. We've been delivering services in Nottingham for the past 20 years, working with complex needs, people presenting with mental ill health, substance misuse, drug and alcohol addiction, mental health, as I said, homelessness, and contact with the criminal justice system, and domestic violence for men and for women. The organisation, BAC-IN organisation, was founded in 2003. We came about in response to gaps in mainstream services, unmet need, and BAME underrepresentation in drug and alcohol treatment services. And the mainstream services at that time and up until now wasn't catering for the needs of the ethnic minority communities in terms of, wasn't responding to their cultural needs, their sort of issues related to racial trauma, to discrimination, to issues with crisis with identity, people from dual heritage backgrounds with addictions. It wasn't responding to the internal, the psychological, the emotional, the spiritual, and the cultural needs of our communities. Mainstream services are responding to the physical, social needs of our communities in terms of if we need medication, we can get medication. If we need help with getting into education, training, into employment, psychiatry, anything like that, they can support us. But it's the internal recovery, the internal well-being that is not responding to, because it does not possess the tools or the knowledge or the understanding of some of the issues that the communities are presenting alongside their drug and alcohol addiction. Yeah, we deliver a range of services from mentoring, peer advocacy, counselling, group work, family support, mediation, community outreach. We also deliver professional training, cultural competence training, addiction recovery training, and everything we deliver, everything we offer is lived experience informed. All our staff have been through the journey, come out on the other side. Now they've had the training, the education, they are skilled up to deliver and to engage effectively with our communities and support the vulnerable people that are presenting with a range of complex issues. So we need skilled workforce that can respond to the issues being presented. All our services are culturally informed, meaning that it takes into account people's culture and the embodiment of race, spirituality, faith, identity. All of those components are included in the way that we work. So we work holistically. We see a person as a whole person, mentally, emotionally, spiritually, socially, psychologically, but also culturally. That is really, really key. And our staff, our team, they reflect the communities that we serve. Predominantly, we are supporting the South Asian communities, the black communities, and the dual heritage communities. And our staff makeup is of these communities, culturally and ethnically. There are a number of challenges and barriers that we have continued to experience. The first one is connected to funding. Now, locally, we've not had any funding from local authorities in Nottingham for the last 7 or 8 years. And yet we are supporting around 100 families from Nottingham City, predominantly Nottingham City, presenting with complex needs. And our funding comes from outside of Nottingham. So that is a very, very serious concern for us. We want to share with Nottingham local authorities, and people are aware of BAC-IN. You know, we're quite visible. Last couple of years we've been very, very visible through research, through social media, through our involvement with the government drug policy, with the drug review, with national research, with top academic institutions like Middlesex University, Cardiff University, Sheffield Hallam University. So we're putting out a lot of information and advocating for BAME communities, and being a strong and proactive voice for BAME service user voice, and a peer-led voice, a lived experience voice. And it's a shame, you know, we are shown interest by national partners about the work that we're doing. They want to work with us, they want to support us, but we need Nottingham to support us. It's almost like over the years, 20 years we've been in Nottingham, reaching some of the most difficult, most challenging, most vulnerable, most broken people in our communities for almost the last 20 years. Now Nottingham, if it doesn't know, will know about it now. We need investment from Nottingham. We are able to reach a lot more families, a lot more communities, and able to provide a range of services to young people, to families, in prison, in the community. There's so much we can do. We feel stigmatized because, is it because we're ex-offenders? Is it because we're people in recovery? Is it because we're from the ethnic minority communities? Is it because you don't trust us? Our communities trust us. How can an organization sustain itself and engage with communities for over 20 years? Trust is key. Trust is key. We have that trust. And we have to speak honestly and openly and transparently about the challenges we're facing. Otherwise, what's the point? We're in recovery. We are rehabilitating individuals. We're in recovery. And honesty is the first characteristic of rehabilitation and getting well. If we can't be honest with ourselves and be honest with you, then what's the point? There is no recovery. There is no rehabilitation. That's the first criteria. You know, that's the first essential quality that we need to that we express, that we develop, we cultivate. So we need to speak honestly about what's going on in our communities. In truth, from my heart, I'm very disappointed. I'm very, very saddened because of the stigma we feel. We feel like collectively, not just me, the whole team, the communities as well, hundreds of families over the years that we've spoken to, that are giving us feedback, that we consulted with, constantly telling us that they've been failed, but they haven't got the voice to voice that. So we got to voice that on their behalf as advocates, as community leaders with lived experience. We have to voice that. So for Nottingham, I'm saddened to say, is there has been a collective failure from local authorities that have overlooked and undermined the lived realities of addiction, mental health, and domestic violence within the BAME organisations, within the black and ethnic minorities communities in Nottingham. Things need to change, and this has got to stop. We need to come together, we need to work collectively, and we've got to work in partnership. You need our support, we need your support, because the inequalities are increasing, the gaps are widening, and the people are falling through. These are real life people, real human beings living in our midst. If we really truly care about Nottingham, as we say we do, let's put our money where our mouth is. We can reach people. We guarantee that with such confidence, with such conviction, we can reach people in Nottingham. We need the resources. We need the partners around us. Recovery can be the capital city in the UK, where recovery and rehabilitation for ethnic minority communities is happening. People are changing, they are coming forward, they are engaging. And now they're becoming productive members of the community, productive members of the society. They are giving back. these one-time stigmatized people, seldom engaged, very rarely heard. These people, these individuals, they're like family to us. They're like my family. If they're hurting, we're hurting. And if our community is hurting, Nottingham should be hurting. If we're working in healthcare, we should be having that level of empathy, that level of sort of wanting to do something different, have that desire. All we hear is talk, talk, a lot of good fancy words, a lot of good talk, but the action isn't happening in the community. Ask our communities, go into our communities, how well your services are catering and advocating for them. You're going to get some terrible responses, very, very sad responses. The responses I'm giving you is an infusion of what I've internalized from the voices from family, the children, the battered wives, the children whose fathers are in jail. This is what I'm expressing. It's a combination of all of those stories. So I become one single voice, but there's a selection of voices in me that I'm expressing. I'm speaking strongly about this because people are hurting, people are dying, and people are struggling. And that struggle needs to stop. And it can stop. We feel confident, with conviction, with faith, that we can bring the change that Nottingham desperately needs. We need to stop overlooking the needs of the ethnic minority population. Looking away, looking the other way doesn't get rid of the problem. Exaggerates the problem, it amplifies the problem. So we need you, you need us. And help us to also reduce the stigma. Invest in some stigma, destigmatizing campaigns, anything like that. Support us so we can support the communities. Because one of the other challenges and barriers is the stigma in the communities that the Black and Asian ethnic minorities community feel. Being addicted, being in prison, coming out of prison, having a mental health condition, that in itself has a community stigma. That also keeps people compounded. The suffering in silence that is happening is phenomenal. It's heartbreaking. And it needs to change. And it needs to change with action, with proaction and investment and development of community grassroots organizations. The communities got the solutions. The solutions are in the communities. We need to invest in the communities, develop community organizations, skill them or train them up so they can deliver. Because we haven't seen it from mainstream services delivering and engaging with our communities at the level that it needs to. I haven't seen it for the last 25 years. If anybody has, please give me some evidence. There's pockets of good work going on, certain levels of good work going on, but the real level, the real place where we need the help is not happening. And that's one of the reasons why BAC-IN as an organization, as an entity, was set up in the first place. One of the first of its kind, a peer-led organization with a focus on abstinence, faith, spirituality, culture, all of those components that are missing across the board in services and other recovery approaches. There are so many success stories with BAC-IN spanning almost 2 decades. But there's a couple that stand out. There's one that stands out, that there was a family that came to see us many, many years ago, and the children were affected by the addiction from the adults in that family. And I remember one young man, he was a teenager at that moment, and he wanted to become an aviator, but he's living in a family that is crippled with addiction. So the young man's self-esteem, his confidence was affected. And we supported that individual. I remember him telling me, I want to fly planes, I want to be an aviator. It was only a wish at that moment, at that time. And we supported the family over the years. And many years later, I get a message from the mother saying that he's a certified pilot, he's flying a plane. So that's really, really beautiful story. But there's other stories as well, like one of our co-founders is gone abroad, it's gone to Brazil, is set up a support service there for young people and families from Brazilian backgrounds, where he's doing, addiction recovery support, using martial arts, using yoga, recovery coaching, a mixture of sort of activities to support people over there. But the other bit is the other successes are in Nottingham. There's a number of people, there's a number of peers who came through BAC-IN who've gone on to do really, really well with their lives, have set up their own organisations and have identified key areas within their prospective communities that they are addressing. And they are running their own organisations, but connected to BAC-IN. And we are called, there's a new term that's given for peer-led organisations. They're called LEROs, Lived Experience Recovery Organisations. And BAC-IN is probably one of probably a small handful of BAME LEROs, Black and Minority Ethnic LEROs. So in Nottingham, there are a number of BAME LEROs that have been set up. And these are individuals from our communities, grassroots, locally, have gone on to do well and set up their own organisations. They are giving back to the community. They are using their lived experience in a leadership way, giving back. And another success is BAC-IN we've got our own book, a book based on lived experience, a book based on a BAME recovery organisation from the heart of Nottingham. The book's title is Shades of Recovery. It looks at BAC-IN's culturally tailored approach to addiction treatment and recovery. This is probably one of the first books of its kind coming from the ethnic minority communities from Nottingham. Shades of Recovery, that's the title. And Shades of Recovery, even though I put pen to it, doesn't belong to me. Shades of Recovery is the embodiment of people living in Nottingham from the ethnic minority communities who have struggled, who have experienced losses to addiction, who have experienced successes through recovery. It's their story. I happen to be chosen to put a pen to it. It belongs to all of us. It belongs to Nottingham City. The government can do a lot to support this area of work, initially by reflecting on the last decades of failed drug and alcohol policy. It has failed a generation of ethnic minority communities. I think to reflect on the low uptake of mainstream services, drug and alcohol services, the poor engagement of mainstream services from ethnic minority communities. The numbers are so low. Look at that, why that is, and why the gaps are sort of widening, and why people are not engaging. The government can do a lot more because the programs that are coming through the drug treatment were not designed with ethnic minority people in mind. It's a very Eurocentric medical model, and the people making decisions around these interventions, around these treatment approaches are clinicians, are professionals, but not people from the ethnic minority communities. Their voices are not included in that design. So structurally, the drug treatment system needs to change. It needs to involve people from the communities. And the government can do a lot more by ring fencing money, by investing in community grassroots organizations, allowing them, giving them the freedom and creativity to support and engage those communities, invest in those communities. That's just a number of sort of things they can do. And we got a couple of articles that are published that kind of goes into a little bit more detail, like Out of Sight, Out of Mind is an article we did, bringing some of the gaps in services and some of the poor engagement in services, for the government's attention, for the drug review, for Dame Carol Black's attention. There's a number of articles that we've done, one in cultural understanding in drink and drug news, another one on race and alcohol in Addiction Alliance, Alcohol Addictions Alliance. We would like the community to get involved with BAC-IN, through volunteering. Volunteering is one of the best ways. People come down here, they volunteer, and we support them through supervision, through training, and skill them up essentially. And if they want to work in this field, then there's an opportunity for them to work in this field. And if they want to work somewhere else, we will support them throughout their journey so they can learn about addiction, recovery, mental health, and within the sort of BAME communities, the severe and multiple disadvantage that our communities are experiencing. So there's a richness of learning here for volunteers. We've had student placements, and in the past we've had volunteers who have gone on to become skilled practitioners in this field. And some of them are working within the local mainstream services now because they've gone on to sort of get the education, the skill learning externally as well, and now they're working in full-time employment. So if you're a family member or someone who's struggling, you can reach us through our website. There's a referral form that you can use to contact us, but also for professionals as well. There's a referral form that you can use if you want to refer someone to BAC-IN services. And family members can use that, concerned others can use that, and it's there for GPs, for other service providers in the city. I would like to thank Unity in the Community and the Second Chance Project and the good work that you are doing in the community.